Basic Immunology Concepts, an Introduction to Laboratory Operations and Lab Safety. So immunology defined. Immunology is the study of the immune system. The immune system is the body's defense mechanism against infections, diseases, and foreign substances. Antibodies, also known as immunoglobulins, are specialized proteins designed to bind to antigens. Antigens are substances that are able to be recognized as self, belonging to the organism, or non-self, foreign, by the immune system. So your immune system consists of a whole bunch of different types of cells, and all those different cells that exist, those white blood cells, are able to identify things as belonging in your body or not belonging in the body. And a lot of those do so using antibodies. And when antibodies are able to bind to something and interact with something, that's going to elicit an immune response. What the antibodies bind to is antigens. And antigens are found on the surface of every cell. So they're the polymers that are found on the outside surface that give that cell its identity. Sometimes I refer to antigens as the cell's ID card or the identification card. When an immune cell comes up to a cell in your body, it's going to scan the surface for that ID card. It's going to look for the series of antigens. And if they don't find anything suspicious, then your immune cells will just float on and look for the next substance to bump into. Now, this is all by random chance that your immune cell is going to bump into something, scan the surface, and see if it's foreign. Now, if your immune system does, your immune cells do bump into something that's foreign, they then start the immune response. There's a whole cascade of events that happens after that. So in clinical immunology or serology, serology is the study and analysis of blood serum, particularly the identification and measurement of antibodies in the serum. Now there's two different aspects to antibodies. So the first aspect is we test the patient's blood to see if they have specific types of antibodies present. So if you've been exposed to an infection in the past, you probably still have antibodies against that infection in your blood. So sometimes it's hard to determine if a person still has the infection or has ever had this particular infection, but if we see the antibodies in the person's bloodstream, we know that at least at some point they've been exposed to it. This is also kind of how vaccines work. So when you get a vaccine, an antigen is injected into your body, and your immune system will mount a major immune response against this antigen, and then you'll have these memory cells that are formed. And memory cells are going to have these primed antibodies ready to go so that if you ever get exposed to the real deal in the future, it will be able to mount that immune response against it and have an overwhelmingly rapid response against it. So in serology, we can determine if patients have certain types of antibodies in their blood, and that can tell us if they've ever been exposed to a particular pathogen, if they have certain diseases, or if they've been vaccinated and their vaccine status is still good. The other aspect of serology, though, is using antibodies to do certain tasks. So serological tests can be used to, like I mentioned, diagnose infections. We can use an antibody if we know that we have an antibody that will only bind to HIV. We can put that antibody on the bottom of a well. We can put the patient's unknown sample on top of that well. And if the antibody that we know is against HIV binds to something in the patient's sample, then we can pretty much assure ourselves that that patient is positive for that virus. Monitor immune responses. So sometimes we want to know if the immune system is functioning properly. We can see if a person has been exposed to a pathogen or has developed immunity after vaccination. Diagnose autoimmune disorders. That's where the body produces antibodies against its own tissues, and we can use serology to diagnose certain types of autoimmune disorders. Blood typing and compatibility testing. The basis of all of our blood typing and compatibility testing is using those the serology methods. Common serological tests include the ELISA, enzyme-linked immunosorbent assay, agglutination tests, and Western blotting. There's different areas of clinical immunology that exist, so we're going to talk about just some basic definitions to start off with, since this is an introductory lecture. So some of these terms may sound familiar. We're just going to now take the lens of the clinical immunologist. So in clinical immunology, autoimmune diseases. So in autoimmune, when you break apart that term, auto refers to self. Immune is talking about the immune system. So just by breaking down that term, autoimmune, self-immune, means that your immune system is attacking itself. Autoimmune diseases are conditions where the immune system mistakenly attacks the body's own tissues. Examples of autoimmune diseases are rheumatoid arthritis, lupus, also known as SLE or systemic lupus erythematosus, type 1 diabetes, multiple sclerosis, and there's many more. The focus of autoimmune disease immunology would be understanding the mechanisms leading to autoimmunity, diagnosing those conditions, and developing treatments to modulate the immune response so that our immune response stops attacking ourselves. Immunodeficiency. If you're deficient in something, you don't have enough of it. Immunodeficiency is talking about conditions where the immune system's ability to fight infection is compromised or absent. You don't have enough of an immune response. Examples include primary immunodeficiencies, severe combined immunodeficiency syndrome, as an example. Primary are typically something that you're born with. Secondary immunodeficiencies are something you typically acquire. So for an example, HIV or AIDS. The focus in immunodeficiency immunology is identifying and treating the conditions where the immune system is weakened, either due to genetic defects or external factors like infections, medications, or malnutrition. Allergies and hypersensitivities. So allergies are a type of hypersensitivity. Hyper means more, a lot, or extra. Sensitivity has to do with how sensitive something is at picking up changes in the body. So if you have a hypersensitivity, you have an overactive or overstimulated immune system. The overactions of the immune system to normally harmless substances such as pollen, food, or animal dander. Examples include asthma, allergic rhinitis, food allergies, anaphylaxis, and many more. The focus is diagnosing allergens, managing allergic reactions, and developing treatments like immunotherapy. Transplant immunology. The study of the immune system's role in organ and tissue transplantation and/or rejection. So sometimes a person's organs fail, or a person has an injury in their body, and they need transplanted tissues or organs from another individual, or even certain animals can serve as organ donors. When this happens, our immune system has to be modulated or controlled so that when we receive a tissue or an organ, our immune system doesn't immediately attack and kill it. Because it is coming from outside of our body, it's foreign, it's not something that we want in our body because our body is very protective. We know what belongs, and anything new that comes into the body, our immune system doesn't like, so we try to attack it. So in transplantation immunology, the focus is preventing and managing transplant rejection. So either where the immune system attacks the incoming organ or tissue, or sometimes the incoming organ and tissue has enough white blood cells from the donor, where when you bring in that organ, those white blood cells will start attacking the new host. And ensuring donor-recipient compatibility through matching and immunosuppression. Immunotherapy. It's a treatment that uses the immune system to fight diseases, especially cancer. Examples include monoclonal antibodies, checkpoint inhibitors, and CAR T cell therapy. We will be exploring these different types of immunotherapy as we go through the course. The focus is developing therapies that enhance or suppress the immune system's response to threat conditions like cancer, autoimmune diseases, and chronic infections. An example of this, my mother has severe autoimmune eczema, and if she does not take her medication, she will have severe and extreme rashes that break out into large areas on her skin that are bleeding. So when we use the immunotherapy treatment, the drug that she's on, it actually modulates some cytokines in her immune system, and it depresses those cytokines so that the overwhelming reaction that her immune system would normally has doesn't exist anymore. So this was a relatively new drug that came out, and it has done amazing things for her. She used to have to take transplant rejection medication for her eczema, and that would completely depress her immune system. So she was prone to getting a lot of infections, and she was classified as immunodeficient. But now, with this new drug, she has a relatively normal immune system. A very small portion, a couple cytokines are or interleukins are depressed, so this medication is now helping her without having the very detrimental effects on that. Vaccine development and immunization. So the study and creation of vaccines to prevent infectious diseases by stimulating an immune response and memory. We'll talk more about this in detail, but basically, as I mentioned earlier, a vaccine, you're going to get a portion of an antigen. You're going to get some type of antigen, portion of a pathogen that is going to stimulate an immune response. And you're going to respond to it as if you were actually exposed to it. When you get this immune response, it's going to develop memory cells. And those memory cells are going to stay in the body, floating around, so that if there's ever the real deal pathogen out in nature that you get exposed to, it's going to mount a very rapid response and clear that pathogen before you ever start to have symptoms. The focus of this field is understanding immune memory, vaccine efficacy, and the development of new vaccines against emerging diseases. Infectious disease immunology, the study of the immune system's response to pathogens such as bacteria, viruses, fungi, and parasites. The focus is diagnosing and treating infections, understanding the immune evasion strategies by pathogens, and developing vaccines and therapeutics. Immunohematology is a subfield that focuses on the immune aspects of blood and blood disorders. Blood typing, cross-matching for transfusions, and autoimmune hemolytic anemia are just a few examples. The focus is to ensure safe blood transfusions, diagnosing blood-related immune disorders, and developing treatments for conditions like hemolytic diseases. Cancer immunology, the study of the interaction between the immune system and cancer cells. Understanding how tumors evade immune detection, developing immunotherapies to target cancer, and improving cancer vaccines. So many cancer cells take on a completely different morphology. They're not normal. We want to know why our immune system still accepts them as normal instead of attacking them and killing them and clearing them from the body. One of the target treatments that we're focusing on now is trying to get our immune system to wake up and recognize that those cancer cells are bad, so that our own immune system can help fight cancer as it's developing or after it's developed. So that's one of the focuses of cancer therapy and cancer treatment right now is, can we get our own immune system to recognize cancer as being foreign and try to attack those cancer cells? Diagnostic immunology. So the development and use of laboratory tests to diagnose immune-related conditions. Serological tests, immunoassays, flow cytometry are a few examples. The focus is creating and redefining diagnostic tools to detect immune system abnormalities, infections, and immune responses. So which areas of the lab use immunology or serology practices? So first of all, when you go into a clinical laboratory, you're not typically going to find a bench labeled immunology. when you go to sit for an ASCP certification exam, you typically don't get certified as a clinical microbiologist. Clinical immunologist. Clinical immunology is sprinkled in the various areas of the clinical lab. So you would see it in clinical microbiology, clinical chemistry, blood bank. There's also other areas of the lab, like urinalysis sometimes uses certain antibody-based tests for diagnostics. The pregnancy test that's usually done at the urinalysis bench. That's testing for HCG that uses antibodies in a dipstick test. That's also the premise of the at-home pregnancy tests that are sold over the counter. So various areas within the lab have immunology sprinkled into it. And we're going to talk in more details about all the different diagnostic practices and how immunology is applied. What are the duties of the clinical immunologist? Lab safety and regulatory compliance, pre-analytical evaluation, analytical evaluation, and post-analytical evaluation. Basically, it's the same duties of every other clinical professional or clinical laboratory professional. So an immunologist typically isn't defined as an immunologist. You're defined as a technologist or a technician in the lab. And you work the various benches, and you know that at those various benches, you're going to be exposed to all of the routine procedures that are similar in the clinical lab. So there's all of this is going to be sprinkled into whichever bench that you're working at for that day. So laboratory safety basics. So we're just going to do a very basic overview of some hazards in the clinical lab. There's biological hazards. The source is infectious agents. Possible injury would be infections. Sharps, needles, lancets, and broken glass. Possible injury would be cuts, punctures, bloodborne pathogen exposure. Chemicals are found in preservatives and reagents. Possible injury would be exposure to toxic, carcinogenic, or caustic agents. Radioactive can be found in equipment and radioisotopes. It could cause damage to a fetus or generalized overexposure to radiation. Electrical, ungrounded or wet equipment and frayed cords could cause burns or shock. Fire or explosive, open flames, and organic chemicals could cause burns or dismemberment. Physical, wet floors, heavy boxes, patients, falls, sprains, or strains. So focusing on biological hazards, one way to prevent biological hazards would be hand hygiene. You want to perform before you touch a patient, after the gloves are removed, before leaving the work area, whenever the hands have been knowingly contaminated, before going to designated break areas, before and after using bathroom facilities, and you want to make sure to use proper technique. You want to wash thoroughly and scrub under the nails for a minimum of 15 seconds. Personal protective equipment is another means for preventing biological hazard exposure. Gloves, gowns, or laboratory coats, masks, goggles, face shields, and plexiglass countertop are some methods. Practicing standard precautions. So standard precautions developed by the Centers for Disease Control and Prevention assume every person in the healthcare setting is potentially infected or colonized by transmittable organisms. When you're working in the laboratory, you want to assume every specimen that you receive is infected and treat it as such. Include hand hygiene, PPE, respiratory hygiene and cough etiquette, and safe needle handling. Biological waste disposal biological waste must be placed in containers labeled with a biohazard symbol. It includes materials with which specimen comes in contact, such as alcohol pads, gauze, and PPE. It involves proper disinfection of non-disposable equipment. Transporting biological specimens, so DOT and IATA regulations, watertight primary container with a screw-on cap wrapped in absorbent material. Specimens wrapped individually in a leak-proof secondary container, and then itemized list of contents in a sealed plastic bag in the outer container. Ice packs between the secondary and outer container. Needle stick precautions are to prevent you from getting stuck by a needle with potentially infectious material. Never recap a needle. Dispose of needles in a sharps container, in a puncture-resistant, leak-proof container labeled with the biohazard symbol. The safe handling of chemicals. You want to avoid getting chemicals on the body, clothes, and work area. To do that, you can wear PPE. Observe strict labeling practices. So if you take a chemical and make reagent out of that chemical, you need to label the container of what you were making with the name of the chemical, the date that you prepared it, and your initials. Prepare reagents under a fume hood. Carefully follow mixing instructions and immediately flush areas with water for at least 15 minutes if skin or eye contact occurs. Safety data sheets are required for hazardous ingredient concentrations greater than 1%. Include information about physical and chemical characteristics, fire, explosion reactivity, health hazards, primary routes of entry, exposure limits and carcinogenic potential, safe handling, spill cleanup, and first aid precautions. Most SDS sheets are provided by the manufacturers or the biotech companies where we order our supplies from. SDS sheets have to be stored in a clearly visible area in every laboratory. Sometimes they're in a binder, sometimes they're stored on a computer. Depends on what type of laboratory you're working in. Quality management is the overall process of guaranteeing quality patient care. There's regulations and guidelines that exist to ensure that the laboratory is performing the tests appropriate to the appropriate standards, that they're releasing accurate results, and that they're doing so in a timely manner. There's the Clinical Laboratory Improvements Amendments, College of American Pathologists, Clinical Laboratory Standards Institute, and the Joint Commission all oversee different areas of quality management. The Quality Management Procedural Manual is the basis for all testing in the immunology laboratory. You must comply with CLSI guidelines. It contains information on all procedures performed in the immunology section of the laboratory. It's reviewed and updated as needed on a regular basis by authorized persons. Pre-analytical variables. So some pre-analytical variables is talking about those variables about the specimen or specimen collection before we actually put that specimen on our analyzers or before we start to test that specimen for anything. So some of the things to look for or consider are patient identifiers, the tests requested, patient preparation, the timing of the specimen collection, the actual collection of the specimen, handling, storage, and documentation. Common pre-analytical errors would be patient misidentification, ordering the wrong test, incorrect specimen type collected, insufficient volume, delayed transport, inadequate processing of the specimen, delayed separation of serum or plasma from the cells, and incorrect storage of the specimen. Quality control ensures standards are met, and it's performed at scheduled times, typically at the beginning of each shift, right before testing happens, during testing, when reagents are changed, when the instrument malfunction has occurred, when test results are questioned. Also, when there's like a new kit that comes in, you have to QC each new kit or a new lot of reagent. You want to QC that. Anytime anything changes, you need to QC, but then also on a regular schedule. The QC process is outlined here. You can go ahead and pause the video and run through this process and kind of see how the flow through the QC process would work. Some common errors would be sample misidentification, erroneous instrument calibration, reagent deterioration. So if the reagent breaks down or the reagent was expired and it's no longer useful. Poor testing technique, instrument malfunction, interfering substances are present, or the misinterpretation of QC data. So in summary, immunology involves the production of, use or detection of antibodies to diagnose, treat, or prevent disease. Immunological procedures are performed in various areas of the lab. While performing immunological procedures, standard precautions, laboratory safety, and quality assurance measures are performed.